Hey, everybody. Good morning, good afternoon, good evening, wherever you are in the world. I am so honored and so happy to be with Dr. Jean Dodds. So I have known of Dr. Dodds. We've never actually been able to meet in person, but I've known about you since I learned about dog health. Your name is on all of the same people's lips that I pay attention to and I value their opinions. So it's good to have you on.
Thank you. My pleasure to be here.
I also am a customer of your thyroid tests. I am told they are the only ones to do. And so I said, great. I don't want a test that isn't the best and doesn't tell me what I don't need. I want to know exactly down to, that uses some very specific. We're going to talk about that in a second. What's the difference in thyroid tests? And it's really important. I did my own thyroid test like 10 years ago, and my doctor's such a genius. And he said, look, we got to really separate out these. I think it's been 10 years. So is it T2, 3, and 4? Are there three of them?
No, 3 and 4.
3 and 4. Mm-hmm. But one of the tests didn't tell us something. And I remember him saying, we absolutely need to drill deeper down into this. And so he put me on a couple, just to balance them out. He put me on a couple natural, remedies, right. And boom, fixed it. Boom. No, I've never been on thyroid medication at all in my life. Now my mom and my sister they're on the natural thyroid or something or other. I don't know anything about that, but it's just very interesting. Thyroids.
It's a genetic predisposition disorder, like most endocrine diseases. And the critical thing in life is not to trigger it. So then you don't express it, even if family members have it.
And what would trigger it in people?
Oh, environmental pollution. We've destroyed the air, the sea, and the earth. Chemicals, toxins, all the things that we're exposed to these days that we really can't get around, or get away from. Fumes, toxic fumes.
But why do those toxins trigger this thing called thyroid?
Well, it's an inherited predisposition, like the major histocompatibility complex genes. In other words, what makes you different if a transplant's needed, except, God forbid, with an identical twin. And there's 3 to 5 genes, a handful only, involved in both human and other mammalian autoimmune diseases, regardless of the type.
Interesting. So I'm trying to think of this in a more simplistic way even. So let's say you've got any toxin. It doesn't matter. You've been exposed to a toxin. If I'm predisposed and I am, the way we think of as consumers, I'm predisposed is a good word, but also like weaker or more susceptible or
yes.
Vulnerable. Mm-hmm. What's happening to the thyroid that it goes, ooh, toxins, ouch, thyroid disease, or the beginning of it?
Well, it's not just the thyroid. It's also the adrenal glands, the pancreas, the other hormones in the body. And what happens is the environmental challenges to the gland affect the receptors on the surface of the cells that make up the thyroid gland, for example.
Yeah.
And those receptors are stimulated. And when those receptors are stimulated, actually, it starts with the pituitary gland, where the pituitary gland produces thyroid stimulating hormone that stimulates the thyroid gland. Well, if you stop the production of thyroid stimulating hormone, the gland isn't stimulated, so it stays basically quiescent. If it's abnormal, it'll stimulate the gland to do things even if you don't want it to. And it has something to do with what we call the now gut-brain axis and the gut-lung axis. And we have the same thing with all the respiratory diseases going on in ourselves and in other species today. And that changes the microbiome, which is all of the organisms that live in our body, and especially in our bowel. Okay. And if the microbiome becomes imbalanced, in other words, harmful bacteria or viruses or fungi or parasites are produced rather than beneficial ones, then you get an upset that affects the brain and the other organs in the body.
Hey there, this is Rob Ryan. I just want to say how much we enjoy making this content for you here. And if you are enjoying it, would you like our video down below? And would you subscribe to our YouTube channel? It sure does help us get discovered by more people like you who need information like this. And also, down below in our description, the top link is to our trial pack. We hope you'll order one for your dog so your dog can have fermented superfoods that give them nutrition like they can't find anywhere else. Hard to get nutrients that are easily absorbed. Thank you very much. Now back to the show. All right. So you said a couple words there that I didn't know the meanings of, but so when we think about we have to get into the respiratory part in a second, but the toxins and the pituitary and all of that, they all work together. I understand that part for sure. And I think my own thyroid, like temporary issue, had to do with, like, I've been an entrepreneur since I was 14. So, I think my adrenals have been, I just, I'm adrenal guy. Yeah, right. So I think I understand the connection, but let's go back a tiny bit into the biome, which I love to talk about. So, give me a scenario of a dog with thyroid disease that you see commonly that you can illustrate the biome issue and the toxin issue in their lives. Maybe.
Okay. Well, one of the things we do all the time still, because of big pharma and big pet food industry, who job is to market to the public, right? And to the professionals, is we over vaccinate when things aren't necessary. There's a huge misunderstanding, either intentional or otherwise, sadly. And then we have all these heartworm, flea, and tick preventatives, all these chemicals that are now being looked at very carefully in class action suits, and especially in Europe, where some of them are now being not allowed anymore. And so, yes, we don't want to have fleas and ticks biting us and our pets, but these chemicals stay around a long time. And even though they tell you if you put them on the surface of the pet, it doesn't get inside, that's not true. Obviously, it doesn't. Now, the other thing that happens is we have from the rectum, when we pass feces, there's Clostridium and E. coli and other organisms in the feces that can contaminate around the anus, the hair, especially in a hairy pet, for example. They get into the vulva, even get into the tip of the penis if the penis is exposed. And those things travel up the body and get into the bowel and other places, and they overwhelm the beneficial bacteria. And so we have lots of ways that this can happen. It can happen from tooth decay. Look what happens to the gums when you have all those organisms growing in the biofilm in the mouth. And what do? We scrape at them, and we may not do it properly under anesthesia with a veterinary cleaning, and those organisms get into the bloodstream and can target the heart. So we have all kinds of things that can happen. You can have chronic ear disease. You can have chronic problems in the face with skin disease that affect the salivary glands. Then you have this swollen salivary glands, which are extremely painful, by the way. And then you're not making saliva, so the animal's not digesting properly. We have the same thing in ourselves. We just don't like to think about them or talk about them the same way.
Yeah. It is interesting. You people think that a dental cleaning is a dental cleaning is a dental cleaning. They're not. Do veterinarians get good education in dental cleanings, do you think?
They do, but part of the problem is that you can have good dental hygienists that make an excellent job of scraping and taking the plaque off the teeth. The problem is that there can be tartar and other things way underneath the gums, which they can't get at because it's too painful. God forbid, you're not going to put something hard scraper deep down underneath the gums. And so animals need to have proper dental cleaning depending on what their tooth and gum health looks like, whether their breath smells badly, etc. And so having an occasional dental cleaning once a year, or once every 2 years, or whatever is necessary, with a qualified, obviously experienced veterinarian is very important. And there are many veterinary dentists now that teach these things to the regular practitioners.
Yeah. And you're talking about under anesthesia.
Yes.
Yeah. So,
So they don't move, so you don't hurt them.
of course, yeah, right. Yeah, I mean, I've done a long time ago, I've done the what is that? Uh, uh,
Non-anesthetic dentistry,
that was the
where
word,
you
I'm sorry,
use some of
anesthetic, yeah.
the mouth rinses or chews or whatever that are supposed to help, and there are some that do help, but not
Yeah.
if it's deep down in.
No, yeah.
Clean
And
the mouth first and then use the dental rinses and the dental chews and whatever.
yeah, I've always thought to myself when I got it done, I thought it was kind of at the beginning of the movement of non-anesthesia dentistry, and I just thought, first of all, this is super stressful. This is, for some dogs that can do it, it's still got to be a little stressful. It's not innate in them. And like, how good can you be getting at any,
Well,
at
they
any
can
of
be
the,
very good. We have dental hygienists that come by appointment to Hemopet regularly to take care of greyhounds and other people's pets. And they know exactly when they need to refer the client to take the animal to a dentist to have it done properly. But they keep up with the cleanings regularly, 2 or 3 times a year, older when they're older, more often when they're older, because the teeth, accumulate things more rapidly with aging.
yeah,
So, and they work very well, and they're trained dental hygienists.
yeah. How do you find a really good non-anesthesia dental hygienist? How would you look for one?
Well, you can go online and ask Dr. Google all those things, and they'll tell you who, depending on your area. You say, I live in area X, and they'll give you a list of all of them, and they'll be starred by, how good they are, what the people's experiences are.
Yeah.
And there's a board of veterinary dentists. And so some of them are boarded, some of them are experienced and non-boarded. That doesn't mean they aren't qualified. Okay.
Yeah.
And then the same thing, you can be a registered veterinary dental hygienist, or you can be an experienced veterinary dental hygienist that isn't registered. And again, that's just you have to know the people, and you have to know the referrals, and many veterinarians will refer to the dental hygienist for the routine work if they don't have the time to do that or the qualified people in their own clinic.
Right. Well, knowing the people, that's the key.
Yes.
Really knowing the people. And it's always it's a very weird subjective thing. Like, it's like how you tell people pick good friends. Well, what does that mean? I know a lot of people that have horrible friends, and they think they've picked good friends, and I watch it and I'm like, well, those aren't very supportive. It's not my definition. So it's always very interesting when people say, well, I've got a great vet, or, it's like when people say I eat healthy. Well, but what does that mean? What are we looking at? What are we measuring it up against? But you do have to know people. You absolutely do.
Absolutely.
Yeah. So,
and trust is so important, isn't it? Trusting that individual and the relationship between that professional is really important.
Well, you happen to know my personal vet, and I was just telling you, I just came from him literally right before our call today. And, I mentioned to you that I go to him for wellness. I look, if I have to come to him for an issue, I do. But 90% of my visits are wellness related, and also to talk to him. And, I'm building, this is a relationship that's important to me.
Yeah.
So if you have I keep telling people that if you have a transactional relationship with your veterinarian or anybody that you trust, that you want close to you when times are tough, you have to invest in that relationship. You absolutely do. And, if veterinarians don't like to say this because, I understand, but I'll say it. When you treat somebody like there's a transaction only involved, you're not going to get, I don't believe you're going to get 100% of their mental and emotional energy focused on you. You want them to know your dog, like your dog, care about your dog, care about you, or animals, multiple animals. It's a very important thing, just the same as I think you should also know your farmer, your rancher. I really do. We have gotten so, like, our relationships have been so sterilized. And of course, social media made it even worse. We're just at these computer distance away from people all the time. And I mean, I love this because for you to get on a plane or me to get on a plane and do this, we get to create education this way. I love it. But I would also really make sure that you and I are actually seeing each other at a conference or an event or something, and we're actually getting personal one-on-one time. There's just nothing better than that.
I think some people get into professions for the capitalistic perspective, and you don't make money doing that. You have to have a passion for it.
Yeah.
And we had an example years ago where someone wanted to get their large dog spayed, and they were quoted a very high price, like twice the going price in the area.
Yeah.
The person was confused, went out the door, went down about a block to another veterinary clinic, went in there and asked the same question, and the price was about half.
Yeah.
So the person went back to the first clinic and said, by the way, I went down the road to your colleague and I got a quote that is half what you quoted.
Yeah.
Oh, we can do it for that price. She said, not on my dog, you're not. And she walked out. Now, how do you like that?
Wow.
I mean, what message did that give to the clinic there, the higher priced one, all the people working there? We can do it for half the price. Then what were you doing? Why were you telling that person it was so expensive when it wasn't the going price in the community where she lived?
Yeah. Yeah. It's really interesting. People have such a short-sighted view of what's really important. And there's such a lack of perspective of like what could happen. And you want somebody really, you want really good relationships. I think people have better relationships with their realtors than they do their vet. It's mind-boggling to me. And with their own doctors, and they treat them horribly. They treat the front staff horribly. Some people, probably not the people watching this right now, especially at this point. But the people who value talent and the art, like, the what you do in your thyroid tests, let's get back to that. And your hemopet, let's put up the website. So hemopet.org. Yours is a next level of thyroid testing. So your vet has like your everyday, we don't need to name the names, your everyday veterinary blood test clinic. They do all kinds of stuff. They'll test for Giardia, they'll test for this, that, whatever. Sometimes your vet can do it in-house, sometimes they send it out. But then
the in-house and the outhouse.
The in-house and the outhouse. So there's that testing, which is your basic thyroid, and then there's like the Gene Dodds Hemopet Gold standard. So tell us what the difference is. I'm sure you've done this a million times. Let's do it again.
Well, there are other laboratories, especially at universities. I'll name one, Michigan State, for example, that has a full thyroid testing profile like we do. What's unique about ours? The first thing we wanted to do was not use radioisotopes, because most endocrine assays are tagged with a radioisotope in people and animals. And we don't want to contaminate the earth. Even though you have all that radiation protection, it doesn't work 100%.
Yeah.
So we went to Europe to look at technology that was developed and patented, that parts of it were patented, that did not have radioisotopes.
Okay.
We started developing that, and then we developed a completely patented now worldwide non-isotopic thyroid profile. Now, the other thing that's unique about our thyroid stuff is the other laboratories have one reference range for all breeds, all ages. Do you think a puppy and a geriatric animal have the same amount of metabolism for endocrine function? Never.
No.
So we had to develop breed-specific and age-specific normal ranges, which we've done based on cumulative data for over 20 years now. And we tweak them as necessary. And we have new breeds and hybrids coming along. And people say, well, how do you do that? I says, well, if you've got a hybrid breed, you're bringing the predispositions of both breeds to the table, and you don't know what's going to happen. So the critical thing about it is to use age and breed specific norms. And that's what makes our test unique. Now, measuring thyroid antibodies is another thing that those in-office tests do not do, because about 80% of the thyroid disease in purebred animals is heritable. And so when you're doing that, you need to, and it's caused by autoimmune activation of the thyroid gland, like I mentioned earlier. So what you have to do is you have to do a thyroid antibody profile. Now, the confusion comes when the practicing veterinarian does the basic panel, maybe even more than just a T4, please God, and gets the results and they look quasi-normal to him or her.
Yep.
Then the owner says, but wait a minute, or the caregiver, I need you to add on that antibody I've read about. So they add on a thyroid antibody and it's positive. Now that animal has to be treated, even though the veterinarian may not believe it has the appropriate clinical signs yet, but it could start having weird behavior and unexplained weight gain, and it's not been overfed. So we have all these issues to educate the clinical veterinarians about why it's really important to do the antibody test, because positivity means you have to shut down TSH, so it doesn't stimulate more antibody. And the only way you can do that is by giving the appropriate dose of thyroid hormone. I say, oh, but the thyroid hormone levels were basically okay. I'm going to make the animal, quotes, hyperthyroid. No, you don't. The body uses what it can, and it excretes what it doesn't need to avoid thyroid toxicity levels. So, and how do we know that? Because we tried it experimentally. We tried it with a little one baby step at a time when we first started doing this 20 years ago. And we found, yes, you do a slightly lower dose than the full therapeutic dose, but you titrate it until you shut off the antibody production. And it'll take 5 to 7 months or even longer for that antibody level to go away. So then the caregiver may be told, oh, now your animal's fine, you can breed it. It still has the genetic predisposition. You've just suppressed its production by the appropriate treatment. So again, there's all this stuff, and we write reviews often about this online. And we're a nonprofit charity, so I'm an unsalaried person. I've never earned a penny from directing Hemopet. So it's not like people say, oh, well, that program is diagnostic. It's all over the world. Dr. Dodds and her husband must be living high off the, quotes, hog, even though we're vegetarians, with this program. Well, we don't pay ourselves anything. We're volunteers. And why? Because for 28 years, I was funded by taxpayers' dollars by the National Institutes of Health to learn the science that I know today. And I decided it was time to give that back to the community that supported me.
That's great. But you know what? I would not begrudge you that. I would, it's so
there's nothing wrong with it. I agree, but this is just my personal thing.
No, I know. And I appreciate that. And I'm not trying to convince you otherwise, but I think
you won't.
But no, what's so weird is how those same folks, we can explain to them that with certain things, certain pharma, there is an over application, over prescription, over whatever, and we might suggest that there's a profit motive at it, and their reply to that is, well, everybody's entitled to make a living.
Sure.
And those same people would say to you, well, Dr. Jean is making money on this thyroid, but it's like, well, where does charity have to do with this? Now, you've made a choice, and that's great, but I mean, it's just so funny that there's a lack of fairness and equity in the way people think about things. It just blows my mind, and I'm not going to be able to solve it. It's unsolvable. It's just very funny that it's like when it comes to the guys who are creating, I think, some of the there's some amazing products, but some of the most underwhelming medical products that exist on the market, but making these crazy huge profits. People are like, well, they got to, provide a return to their shareholders. And okay, yeah, no, I get it. But also, like, let's be equal here,
Yeah, but that doesn't make me moralistically better. It just happens to be my choice. And I don't, And I don't blame anybody that decides that they're going to be a capitalist and that they need to make money and they need to have a profit motive for what they're doing. That's okay. As long as the science and the medicine is good,
Yep.
the other stuff is not really relevant to the discussion.
Yeah. Well, I've always believed that if you can, if you can serve, in our case, it's animals, but if you can serve a population, people, animals, and serve them well, very, very well, at a very high level with a very honest, really, really good product, you're able and should be able to profit unselfishly.
Yeah, sure.
It's just the treatment of, poorly treating people and employees, and then it gets into that whole philosophical discussion, which is a no-win situation, because some people think they should be making this, some people think they should be making this, but it's something that I think is very interesting. And I just, I think you should be living in a castle for all the work you've done to, with a moat with, alligators. I think,
Of course,
right? Of course. What I think is, that is the first thing I heard about you in your HemoPet thyroid test, which was the reference library, and you're being able to actually reference way more than,
Mhm.
yeah. So, and then what are these products called? What do people tell if a vet doesn't know about HemoPet and they want their vet to use a HemoPet thyroid test, what do we call it?
Well, the complete profile is thyroid profile 5. That's total T4, the free unbound fraction, which is less than 1%. And that's the biologically active form of the hormone. The rest is just a reserve. Total T3,
yeah.
And then the free fraction of T3. By the way, some of the top laboratories now no longer measure it because they can't get the reagent they used to use. We still have it, and we still do it, because the free fraction, again, the small amount, is the biologically important one that the body needs to know. And then the fifth thing is the thyroglobulin autoantibody, the antibody I mentioned before for autoimmune heritable thyroid disease, which is like human Hashimoto's disease.
Yep.
It's lymphocytic thyroiditis. And there's only one reagent that the whole world uses for that assay. And it will detect about, from our experience, 82 to 85% of those animals that truly have the heritable autoimmune form of the disease. It'll miss a few. And those can be detected sometimes by circulating antibodies against T4 and T3, which is an additive test that can be done. In other words, thyroid profile 5 can have these two antibodies, anti-T3 and anti-T4, added on if the basic profile looks like it's appropriate. And there's ways, I won't go into details, that we know that. And the same thing is true in the other laboratories. They can do that as well.
What's with the other 15% that can't be detected?
Well, it's called idiopathic thyroid atrophy, believe it or not. Idiopathic meaning we're too stupid to figure out what it is. Idiot pathology, right? Idiopathic thyroid atrophy meaning a shrinking of the thyroid gland so that it can't work as well as it is. And the information in humans would suggest it's the same kind of pathogenesis reason, but you just can't measure it.
Wow, interesting.
You still treat it. You still treat the patient.
Okay. Yeah. So let's go back, just rewind a little bit to the gut. We were talking about lung and
the gut brain and the gut lung axis. Yes.
Yeah. So why don't we just crack that open a little bit more? So can you go into a little bit more depth on that, and as it relates to thyroid and how those connect a little bit?
Okay. The microbiome has all the organisms in the body. Okay. Whether it be bacterial, fungus, parasite, toxin, whatever.
Yep.
And it has 200 times more activity than the rest of the body.
Activity.
Yeah, well, function, different kinds of functions.
Enzymatic.
Yeah, whatever.
Yep.
So it's an amazing thing. And then, so the point is we have to keep the front of the body and the back of the body as healthy as possible to prevent organisms from getting in through the mouth and the nose and the gum, the biofilm, or the rectum. Okay. And we need to keep that to keep it get healthy. And
Or urethra.
female animals are much more likely to get infections from the rectum, from organisms from the stool, than a male, because it's farther away.
Yep.
Okay.
So then how is that? How are they linked to the thyroid though?
Okay. Well, anything that affects these the microbiome and the microorganisms then circulates into the epithelium of the surface of the bowel, and then from there into the blood vessels. Okay. And as soon as the blood vessels take it up, they filter it through the kidneys or the liver or the adrenal glands, and then it goes to the brain, the pituitary, and the thyroid gland. So the thyroid's a master gland. It controls everything. And so when the microbiome is imbalanced, the thyroid is going to be involved either directly or indirectly at some point.
Yeah. Wow.
I mean, there's so many things diagnostically. For example, alkaline phosphatase is an enzyme that's used all the time to measure liver function and adrenal function. It goes up as animals age. And so when people do routine, wellness exams like you just have done and testing, and they see the alkaline phosphatase getting elevated when the animal's 8 or 10 or 12 or, please God, even older, they think it's abnormal. It's not. It's normal because the adrenal gland still makes sex steroids.
Yeah.
And the sex steroids affect how the liver functions, and you get like Swiss cheese holes in the liver, which increase the alkaline phosphatase level. It's perfectly normal. We don't treat that.
Wow. Sidebar real quick on the sex organs, the sex
steroids.
Steroids, yeah, thank you. With a dog that's been a male dog, let's say that's been fixed, there's a testosterone replacement therapy now. What do you think about those for people or dogs?
We don't usually need to do that, because if the adrenal glands are functioning normally in a neutered male or a spayed female, you're still getting the sex hormones from those glands. Now, part of the problem with testosterone, either an implant or a treatment, is the normal value goes from 0 to 2,000. So how do you know what you're doing?
Yeah.
Frankly, it's a little different with, well, you can argue that one of the biggest problems is people that have intact females that are trying to keep them from pregnancy by giving them prostaglandins and other things. And of course, they're promoting pyometra and other secondary infections. So it's very difficult when you, in my view, when you start fooling with Mother Nature.
Yeah.
Very difficult.
You better be ready. That's all. You better be ready. So Gus is my first dog I've had that I haven't neutered, and it's the most amazing thing to see him at age 7 now. Like it's amazing. He's got full, I can't do it, but he can touch his paws still to his arms like a puppy. He has full flexibility. My labs I've always had labs. My labs have never done that, have been able to do that. So you could just tell the way he moves, the way he sits, all of it's perfect. He's super flexible and at ease, and his muscles are healthy. He's super athletic, and you can't keep weight on him. I mean, I feed him like probably 2+ pounds of raw food a day, and talk about nutrient dense. I mean, it's crazy what I feed this dog. And I just recently had to give him like a series of meals with sweet potato to put extra weight on him.
More fiber and extra weight, right?
Yeah, just some carbs, because he's just he's built he's a Labrador that's built like a coyote. I mean, he's just so.
What does my colleague and friend, your veterinarian, tell you about prostatic risk as he gets older? Should he be neutered when he's much older? What does he say about that?
What he told me is, if he gets the testicular cancer, let's say, we just snip him off.
Well, or prostatitis, I was thinking also.
Oh, prostatitis. Yeah, we didn't really go into that.
Well, no, I'm only curious because the biggest problem with females that aren't spayed is the risk, of course, of the other reproductive issues. They're much higher risk if they're not spayed. And the question is, after you finish competition or whatever you're doing with an animal, should they be neutered or spayed? You know, the thoughts are changing all the time about whether to do that.
Listen, that's interesting. I'm all ears. If I thought that, you know, he's not competing or anything, he's just, I want him to live his.
I would ask him, and I would trust whatever he says, whatever his experience is. It changes it seems every 7 years. What we learn in science and medicine changes. It's a 7-year cycle, like the 7-year itch, right?
It's so true. I mean, and it's so funny how little we know.
Right.
You know, I mean, we know so little about so many things. And, you know, in our line of work with the microbiome, I mean, please, we can fit it in a thimble compared to the universe that we know is ahead. You know, it's incredible.
Amazing.
Can we get into now, transition into this virus thing that is going all over the internet about what dogs are getting, and we don't know if it's bacterial, viral, or, you know, can we talk a little bit about that?
This is the atypical canine respiratory syndrome. And you may have seen on the news today that we're concerned now about the new respiratory illness outbreaks in people that are not related, by the way. They're unrelated. But it's interesting that the environment has promoted new infectious agents that are harming people with respiratory illnesses, cold, flu-like symptoms. And in addition to SARS and the latest, you know, new vaccines for COVID-19, et cetera, all of these issues are really a problem. But we have what we have in San Diego. The pneumonias that occurred after the atypical respiratory thing lasted for 6 or 8 weeks.
Ooh.
And they found Streptococcus zooepidemicus along with other bacteria. But that doesn't mean that that's the cause. And we have the outbreaks in the Northwest, in Washington, Oregon. They have 200 cases in Oregon, around the Great Lakes now, Colorado, and it's spreading everywhere. So the question is, what do we do? The point is that I gave you the latest information. The American Veterinary Medical Association website has the recommendations to do that. And they say that all of the animals should be checked for parasites, obviously, wormed if appropriate, fed a balanced diet, and they should be up to date on the necessary vaccines, which they believe includes canine influenza. And there's an argument about that. They say the kennel cough vaccines, including Bordetella, and they say give the intranasal. I disagree with that completely. It should be the oral version. First of all, the injectable Bordetella vaccine does not stimulate the vaccinated individual's interferon, which is a natural antibody that helps protect us all. We have it as well, to protect us against foreign invaders. The intranasal one sprays around the nose and the eyes and the rest of the face and anybody nearby that's giving it. Why would you want to do that when there's an oral version, the newest one, an oral Bordetella vaccine that works just as well? And the other interesting thing about it is if you decide not to give hepatitis adenovirus 2 vaccines in the puppy series, for example, you just want to give, say, distemper and parvo, you don't want to put the adeno with it because the studies from years ago from Tom Phillips and Ron Schultz showed that you suppress cell-mediated immunity, that's your tissue immunity, for up to 10 days. Ooh. Why would you want to do that to a puppy? No. So you give the other alternative vaccines, and they're now approaching puberty, or 6 months or longer, and then you give them the oral Bordetella. And guess what? That protects against adenovirus 2, which gives them the hepatitis equivalent separated out, because you can't buy hepatitis vaccine by itself. And you can't even buy distemper vaccine, the original one, by itself anymore. They're all back now to small combos. Yeah. So we're sort of stuck. We have the, quotes, combo wombo phenomenon. Now, you know what they've said in some human vaccinology expert literature? We
No.
should follow veterinary medicine and give our babies and infants combinations of vaccines so they don't have to keep coming back. Oh my God. That's exactly the wrong lesson we were trying to tell them, because
Wow.
more adverse reactions occur with the combination products than the monovalent or bivalent vaccines. There's good evidence for that.
I was born in 71. When we were kids, we had 3-ish vaccines, and now I think, are there 76 in kids now?
Oh, there's
70?
a whole bunch.
Yeah.
And some of the vaccines contain thimerosal mercury salts.
Yeah.
And they're now saying you should never give that to youngsters. You should wait until they're preferably a year old, a minimum of 6 months of age, preferably a year old, before you give them any vaccine that has a heavy metal in it, including aluminum.
Yeah. Well, they've taken out a lot of thimerosal and a lot of the human ones, but they replaced it with aluminum.
That's correct.
Yeah.
They took out the original mercuries and they replaced it with aluminum. But there are other preservatives that can be used now,
Yeah.
or not, none of those things. And so what are we going to do? The industry isn't going to change until they sell the millions of doses they have in their inventory. But the government needs to be more forceful about that. And of course, the problem is, as in our country, big industry supports the government. So, how do we get out of the good versus evil dilemma here, which the whole world is facing these days?
Yeah, they're hand in glove, unfortunately. But you said something about inventory, and that is, I used to know a very, very big pharmaceutical executive, and it's why wouldn't it be? It's a real thing. It reminds me of this spray that they're trying to get us to use for our dogs, this nasal spray. It seems to me like it's just excess inventory they want to get rid of, so the new oral can then be sold. I mean, why would you destroy, if you're a business trying to, make and your business is these products, you wouldn't want to throw your product away. You want to sell the inventory, right?
But part of the problem is there's only one, well, maybe there's a second one now, oral vaccine. And so the other companies don't have it. So they're sort of out of the competition, which is a problem. And with the heavy metals in vaccines, the companies that still use them are not going to be promoted if we try to keep teaching a safer way, which I'll never stop doing, because ethically, morally, I have to do that.
Yeah. There's so many directions I could go with you on this. It's crazy. So let's get back to so why did you bring up hepatitis with regards to this illness that's happening in dogs, the hepatitis vaccine?
Just because the combo wombo contains it. It's the H2 or A2 in the DHLPP, whatever. I mean, I had a case just recently where an animal was seizuring, young small breed animal, young adult, was seizuring, went to the veterinarian for the seizures, and that very day got a leptospirosis bacterin. And leptospirosis bacterin causes 85% of the adverse reactions from kill vaccines.
Oof.
Whatever, because of just its nature. It's a mixture, okay? And it doesn't protect against all the strains of leptospirosis. It only has 4 strains in it, when there's 7 that are clinically important right now of the several hundred possible types of leptospirosis organism. So that's part of the problem. Then what happened was 13 days later, the dog went back for the regular booster and got a DHLPP, which means it got a second dose of lepto in that combo because it comes with it. So here's a dilemma. The veterinary clinic obviously didn't think about, well, first of all, would they vaccinate an animal who just had seizures before they knew what was going on? That's another issue. But let's say they honestly believed that there was a high-risk exposure where they lived or what the animal's lifestyle was. Then when they came back again, they forgot that there was an L in that combo. So now you've got a double dose of that particular bacterin, 2 close together. So, and well-meaning, absolutely.
Yeah.
Well-meaning, just, misleading, misinformed, whatever. Vaccines are distilled water. They're really safe, right?
Yeah, right. I mean, it's also the thing you brought up about it not being all the, there's many versions of these illnesses that you can't have a treatment or a vaccination that addresses all of them. It's just like our flu, this flu vaccine you can get yearly. There's
Right.
like a bazillion flu
Well, it's mutating all the time in people.
Yeah. So all you're doing is you're trying to solve for one or two, in the year that they predict will be the big thing. It's just, I don't know.
But look at what happened with avian influenza that started in the East, in the Asian countries.
Yeah.
And the wild animals, the wild birds, brought it over to the rest of the world. Oh, for sure. And avian influenza is a horrible thing. I mean, we say in California that like West Nile virus, if you see dead crows and horses that are sick, be careful because you've got West Nile. So anyway, an avian influenza is horrible. So the commercial poultry flocks, the backyard poultry people, they're being absolutely decimated by avian influenza. Now, interestingly, 21 endangered condors in South America died from avian influenza.
Oh boy.
They've developed a vaccine for it. There's no vaccine for the rest of it. Okay. They've given that vaccine, and the condors so far have been protected and are surviving. Thank God. We've seen them. They're magnificent creatures. Okay. Yes. 21 died until they developed the vaccine. So there was a special niche need, right? For an acute emergency need to protect the condors, and it's worked. It just was published maybe 2 weeks ago.
That's good news about it's a good vaccine story. I like that.
Yeah,
that's
me
awesome.
Too.
So now back to the average pet owner. I still say pet owner. Guardian's hard for me to say, but guardian pet owner. They're walking their dogs. They're boarding their dogs because they're going on vacation. The holidays are coming. What would you say in your professional, incredibly, your illustrious career? What would you say would be your recommendations for dogs that have to go to boarding facilities and all that stuff?
Well, they have to be very, very careful. When you're petting other unknown animals out when they're walking and whatever, you really shouldn't do that right now with the respiratory illness. Okay. And remember, when you think you could have contaminated yourself by another animal going into a grooming or boarding facility where you open the doors, you're touching places where other people have touched them that may be carrying whatever. You wash your hands with warm, soapy water. And you wash up to your arms and you keep them clean and then you dry them. This is the same thing you do if you're exposed to SARS-CoV-2, the original studies before we knew more about COVID-19.
Sure.
What do? I mean, some groomers and boarding facilities require Bordetella, whatever vaccines 2 or 3 times a year.
Yeah.
You have to decide whether you're going to ask them if they'll take a written waiver to that you will hold their facility harmless should your animal, if it's boarded or groomed there, get an upper respiratory cough. Okay, that's one thing. Yeah. And you say, well, why would you do that? Because if these people believe that these vaccines are 100% protective, which they aren't, by the way, but never mind. So how could the animals that are sitting there having been vaccinated give this other person's pet anything? And how could they catch anything?
That's right.
So again, you have to do that. And there are boarding and grooming facilities that will take this kind of a waiver only to be held harmless. Okay. You have to do that. The other thing is, let's have more people come and take care of the animals in their own home.
Yeah.
A pet sitter, a qualified, experienced pet sitter come in to your own home, making sure that if they have animals of their own, that they're healthy, obviously, or some who don't have animals.
Sure. And then what would you recommend in terms of any preventatives, mushrooms, any,
medicinal mushrooms are excellent. And, the latest data confirms in humans as well that lion's mane is a functional, important medicinal mushroom. So medicinal mushrooms are important. Proper diet, try to avoid pro-inflammatory meats like chicken and venison, for example. If you have an animal with a GI problem, try to definitely avoid grains that have, sprays, for example, And I'll use the example of corn. Field corn is sprayed with glyphosate and other pesticides and herbicides. You really don't want to do that. So if you're going to feed a meat-based product, it should really be grass-fed, just like milk should be grass-fed, preferably. Not that the grasses aren't sprayed, but they're generally not. Most lamb can be grass-fed, except in the wintertime. And in the Northeast, some of even the best farmers still have to feed some grains to their lambs because they don't have enough grass to do that. So you have to find out what does the meat, where did the meat come from? What was it fed? Maybe you buy your meat products from Australia and New Zealand where they treat them differently.
Yeah.
I'm just
or some really great, there's a lot of great regenerative farms that are as clean,
absolutely,
frankly better than organic.
Yeah.
They
And
just
buy locally, go to your farmer's market,
Yes.
buy locally, support your local community. Absolutely.
Yeah. Just try to have as much super clean, pristine quality in your dog's bowl as you can, both veg and meat.
And remember that if it's a raw diet, you want to be careful if there's an infant crawling around, because they're going to crawl around to the raw diet, put their hands into the bowl and eat some of it. And some of the organisms that are normally carried and protected from pets would be not safe for an infant, for example.
That's valid. That's valid. If I had a newborn, I would pick up my dog's bowl and I would wash it and then put it down. If I have an infant,
and feed them slightly raised up so they don't have to end up, bending their neck too much to do that. Slightly raised up bowls. If you've got cats, remember you can put foods you don't want the pets or the infants exposed to on the counter, and the cat will knock it off.
Right.
So be careful. Just like flame retardants, right? Issues about some of the adverse effects of flame retardants on, again, people, infants, and pets.
Yeah. Those are.
You could go on and on, right?
You sure could. I mean, it's just so nuts. It's like, there's an hour of a chat right there. The stuff we're doing to protect against, the possible fire. Okay, I get it. But like, if there's a fire by your infant and it's not in a flame retardant suit, it's going to be consumed by flames. I don't know why that a fire retardant. I just don't understand why we do what we do sometimes.
But the public can read a lot about that. They go online on your search engines, as I say, Dr. Google, and you ask a question and you'll see 4 or 5 websites that drop down that tell you, and try to use the ones that are from an academic institution or a recognized, like the FDA Center for Veterinary Medicine, for example, just as one example. You can go on Wikipedia, for example, and read all about the background of how some of these things occurred and the references on those articles. You click on them and you can get the actual papers involved. So please try to do that. There's free websites, foodsafetynews.com.
Okay.
geneticengineeringnews.com. These are all free websites that you can get and you can read.
Food Safety News I knew about, but not, what is the other one?
Genetic Engineering News.
Genetic Engineering
It's actually Genetic Engineering and Biotechnology News.
Oh,
that's the actual name.
That sounds like a nightmare for me. I will go down.
It's easy. It's easy.
No, but I just mean it sounds like it's gonna result in sleepless nights.
Well, yeah, it can. I mean, I read these things every single day, and I teach these things because I'm reading what's going on in the real world today. And so we can take the nuggets of information that we need to share from there, and you don't have to read the actual scientific publication. This gives you a summary, a couple of paragraphs. If you're really interested, you click the link and you get the actual paper from a group of scientists you've never heard of in Romania that did something outstanding.
Yeah. It is amazing when you read these papers, how many amazing, awesome, like just special people are out there doing like hero work. It is incredible.
Right.
The ones that aren't bought and paid for by other sources. What I wanted to ask about now is this whole idea of informing yourself and in being an informed consumer of health information. Do you think the future of veterinary, you've said twice, Dr. Google, and or three times, when I normally hear Dr. Google, it's in a negative way. Vets don't like people Googling for their own information. I happen to think, let me just I'll share what I think, and I'd really like to hear what you think. I think the future of, now that we have access to so much information, and even just frankly podcasts, let alone search engines, but there's so much information and discussion going on about health and results people are getting and not getting. I think the future of veterinary medicine is a collaboration and a more intimate, I'll say, relationship with an informed consumer, and they shouldn't be afraid of people that are doing their own research. Do you feel that way? And more of a person taking control of their own health and their pet's health.
No, I agree with you completely. And, the only reason I mention things like Dr. Google is people don't know where to go. You've got WebMD, you've got PetMD, you've got a lot of, and that's only an entree to the other sources. Yeah. Because you're not going to do Google itself. You're going to do what they recommend. You ask a question, simple question. You can ask a question about yourself, about diet, about whatever. And we need to work together. And the medical professions, I have two adult stepsons that are both cardiologists for people, one pediatric and one an adult cardiologist. I mean, they're all incredibly well educated. They're all in the healthcare fields, but they don't read things either. I mean, we went to the home of one of them, and they have a Bernedoodle. Lovely, lovely, sweet dog. But when you have the hybrid, you have, their shishi, and you pay a fortune and whatever. But anyway, and they're giving the dog one of the combo heartworm, flea, and tick products because they thought it would be easier to use one product every 3 months to kill everything rather than have to give 3 times.
Well, they're correct. It is easier.
Well, I know.
But it's horrible.
And I looked at them. I said, wait a minute. You're both physicians. You know better than that. Being easy doesn't make it better. And they changed right away, but they hadn't looked. They hadn't looked at the product they were giving their beloved, pet living in the home with their 2 sons. So what do we do about that?
Then I think you move in that category of like, whoops, humans, whoops, these are just mistakes, and we're living our lives, and and it's okay to make mistakes. I mean, I made them. We all make them.
I wasn't nasty about it. I was just letting them be informed. And so we need, if the professionals aren't checking because they're so busy with their lives, how can you expect the average pet caregiver to know what to check? So that's why the veterinarian has to develop this trust that we talked about earlier, where you trust your veterinarian to keep involved. And when you ask a question, they should be willing, if they don't know the answer, say, hey, I don't know the answer to that. Let me look it up and I'll get back to you. That's perfectly okay.
Yep. Well, and have a list when you're not at your vet's office. Just have a list of questions, even if they're silly. You think they're silly. Just go down. I keep it on my phone. I keep a running notepad of questions, and it's easy peasy. Really is. So we were going down the topicals. I always find it so interesting. Like, I can't believe there's not been some sort of class action lawsuit or something where, like, people who pet innocently other dogs that have this on them, and they are getting, they're basically getting exposed to a toxin, because on the label of these things it says don't, humans aren't supposed to play with this stuff.
Right.
But yet you put it on a dog, and your kid is kissing and playing, and you're touching your eyes and your mouth and whatever, you're touching food. It like boggles my mind. Like, how have these have been in existence for forever? I don't get it.
There are 2 huge class action suits ongoing right now in North America. Absolutely. Okay. Yeah. Over 2,000 complainants in Canada and 4,000 in America.
Whoa.
Yeah, they're currently being actively, looked at. And I actually am a scientist who's given scientific opinion. I'm not paid. I don't advocate or whatever. I'm just looking at the science. And there's been international publications recently, Australia, Argentina, Japan, for example, looking at the safety of these products at the chemical level.
Hmm. Do you think you could send me those
Sure, of
two
course.
lawsuits?
Happy
Okay,
to.
great. So yeah, that just it really boggles my mind how on the one hand they're stating that it's dangerous, and the other hand, like they're not even addressing and people aren't even thinking about all the touching that's going on, and contaminating themselves with this
But
topical.
what about secondhand smoke? Huh?
Yeah, I mean, I
People
get
don't
it.
even think about the fact that secondhand smoke damages and harms the pets that are in the home as well as the people.
I just considered at least partially living over in Austin. And I've asked some of the most brilliant veterinarians, and they're all telling me, yeah, you're pretty much not going to be able to go without a heartworm medication.
But there's
Not
some
for
that are
me,
much
not
safer
for
than
me,
others.
but for my dog.
There's some that are safer than others, for sure.
There are some that are safer than others. They've told me those, but that just solidified. I'm not moving there. I have the ability to, and I go there often. I'm just going to have to make more trips without my dogs, or in this case, I have one dog right now. But when I have multiple dogs, I just won't bring my dogs there. And it's just like that's just. I understand some people have to move for their jobs and all this, and I totally
Right.
understand, But I just think this stuff is so. It's it, and it works, but it also doesn't work 100% of the time. I just
Right.
talked to a veterinarian who said, their dog, this person's dog was on a heart worm medication, oral for years and years, and it got heartworm and died of heartworm, and they didn't know it because they assumed heartworm's
And
taken care of. So it doesn't work 100% of the time, and it's essentially a toxin. It's
some of the
killing.
natural things like black walnut. I mean, we had a veterinarian in the East Coast that was using black walnut exclusively for heartworm protection for years, and he was sure it worked until he got a positive case. And I said,
Yeah.
you know what? The chances of you, if it, you don't know whether it worked or didn't,
Well,
until you
and
got a positive case. In that
yeah,
case, it didn't work.
yeah.
So did it work in all the other dogs, or was it just chance? Who knows?
Who knows? And probably if you're working with a vet who uses black walnut, who's holistic and probably recommends a really good diet, these dogs are
It'd be
hardy.
okay. They're
Yeah, these dogs are
stronger.
hardy and
Right.
really, but the way you have to catch these heartworm is so difficult because of the way they gestate and all that stuff. I think is that the right word?
Well, yeah, and also at certain times of the year, depending on the climate, they're not active.
Yeah, yeah,
Okay,
yeah,
so
yeah,
you have to get a mosquitoes producing at a time of the year when they're going to be carrying heartworm. Okay,
yeah. I
not
mean,
not in the dead of winter in
no,
Montana or
no.
wherever.
And I think actually even heartworm, like it's a really it's a really high temperature. I think it's like maybe 56
It
degrees
has
or
to be over 56 degrees and it has to be for more than a couple of weeks.
yeah,
Yeah, to do that. So you're looking at maybe, depending on climate change, unfortunately, March and April to October, November, you use it, and the rest of the time you're okay. If you live in a temperate climate, as opposed to, like you talked about in Texas,
yeah,
or
yeah,
Florida or whatever, or
yeah.
Louisiana.
I mean, I would love it if black walnut would work, but I'm as natural as I think most people should be and could be. But I'll tell you what, I'm not chancing
No,
heartworm with
no.
black walnut.
I'm only using that as an example
Yeah,
of someone, and maybe it did work on most of those patients. We don't know.
yeah, we don't know.
But it was a shock for him when he got a positive case, you know. But that could happen anyway, as you said, with even the strongest heartworm preventatives are not 100% effective. Nothing in
Yeah,
life is 100% effective other than death and taxes, right?
right, exactly, and change.
Yeah, it'll
Um,
change.
So what about, let's go back to this illness that's going around that is still fairly young and new and all of that. What would you say that, obviously diet, number one, it's time to improve your diet of your dogs. Don't,
Keep the animals out of very bad climate change conditions like heavy rain, chills, wind where they're blowing, all kinds of things around, right? Dust and stuff. Just common sense. And, if you have to board and groom your animals, we've talked a little bit about what you can do. But again, we don't know. Will it be self-limiting? Again, we don't know. Hopefully, because nobody's identified. Even Cornell says we don't know what the organism is, if there is one or a combination. We don't know what they are. But obviously, there's lots of excellent science people working now to try to figure out, are there different things going on? Do they all look the same, but they're different? Is it because we've changed the climate and different organisms have a different home in the area where they are? It doesn't have to be the same thing.
Yeah. It's so, to use the pun, you're chasing your tail a lot of times when you're trying to prevent or solve or optimize to prevent a disease, a certain disease or illness. It's really hard to do. With the big overall thing I go back to is I calm my mind and I said, look, it's about resilience. It's about health and resilience, and that's the best shot I've got. If whether it's myself or my dog or dogs, when I have multiple, I always focus on really high quality diet, eliminating toxins. Basically you're trying to have more good and less bad.
Yeah, and reducing stress and anxiety to the extent possible. Remembering exercise is an important part of all of that for all of us,
Yeah.
and the animals. So again, just it'll be okay.
Yeah, it'll be okay. I'm convinced of it. I'm not worried about it. But I am also going to not. I'm not going to pet other dogs for a little bit. I think that's super easy and totally advised. Very, very smart, wise. And if I do, then I'll make sure I wash my hands and all that.
Yeah, warm soapy water. I think it's at least what is it, 5 minutes? I think something, or 7. I forget what.
Well, I thought it was supposed to be the ABCs, but maybe not. I'll use I use a really good natural cleaner that is not antibacterial, but it's really good. So I'll use something like that. Well, Dr. Dodds, thank you very, very, very much. What a fun conversation that I think we covered like 4 areas. I thought we were going to cover one today.
We covered a lot, right?
Yeah. I hope you'll be back again and we could go down some more rabbit holes together.
Absolutely. Enjoy that. Be
Thank
well.
you.
Love everybody.
Thank you, everybody. And thanks again, Dr. Dodds at HemoPet, HEMOPET.org. Please visit it. Have your vet visit it if they don't know about it. And if you have especially with older dogs, drill down into the thyroid and make sure you're
and cats too. We do cats as well.
And cats too. Yep. All right, everybody. Thank you so much for watching. Have a great day.